All right, so quickly looking at another type of tumor growth that could occur in the endometrium. So endometrium is that surface inside the uterus. Okay, just trying to break down concepts to as basic as we can. All right, so if you have the uterus, all right, you have the uterus. Let me say, this is the uterus. Comes like this. All right, covers up like this. Okay, then you have, so this space inside is what is known as the endometrium. So you can have a tumor growth growing there, which is known as what, the endometrial stromal sarcoma. Many tumors could occur there, you understand? We're just trying to look at different types and the differences we have between them. So it's just a rare malignant tumor. When we say something is malignant, it has the possibility of leaving that place to go and affect another place. So it arises from the stroma. Those are the connective tissues of the endometrium. Endometrium is that lining of the uterus. Okay, so it's a subtype of uterine sarcoma. It's distinct from the more common endometrial carcinoma, right? And it accounts for about 15 to 20% of all the uterine cancers. You understand? So for the types of the endometrial stromal carcinoma, again, we have the endometrial stromal nodule, we have the low grade one, we have the high grade one, we have the undifferentiated. All right, then that's just it, right? But basically you can just know it as it should. All right, of course the uterus is now looking different from what its originality is supposed to be. So symptoms is such a person that have this type of cancers, they might be having a lot of bleeding, and this bleeding is from the uterus. They'll be having so much pelvic pain. All right, there's also pressure. There's a pelvic mass and it's becoming so large. When they try to urinate, there's a whole lot of pain. Do you understand? Then of course, if I want to diagnose this, the uterus is buried deep into the pelvis, so I want to do imaging. If I do imaging, I see it, I can still want to collect some tissues and send it to the lab. All right, so that can be specific. It can help me rule out other conditions that could basically, come up with these symptoms. You understand? So molecular testing to see if there's gene fusions. That's basically mutations in any of these listed genes. Treatment is, of course, you have a tumor, so you want to cut it out. All right, hormone therapies, chemotherapies, or radiation. Right, if you want to clear up the remaining cells, that's after you have cut out the bulk of the tumor, you use these ones to tidy up the environment.